Welcome everyone in the room. Thank you so much for coming. Stockholm's a very busy place, so we appreciate you being with us, and thanks to everyone who's online. I know some of you have gotten up early. So the session I hope that you're here for is lead in drinking water from problems to solutions. And I'm just going to give a little bit of a welcome to you before passing it on to my colleagues. But my name is Bruce Gordon, and I'm the head of WASH at WHO headquarters. And then let me just say a few things about lead. Lead is a priority chemical contaminant for WHO, so that's across the board. So something we're really concerned about. And on the evidence side, I'm sure that we've all sort of familiar with lead. The science isn't necessarily particularly helpful for practice in the sense that there's no safe lead level. And in fact, I would argue that some of the science isn't necessarily clear on how we prioritize lead with respect to other public health issues. Where should we put our funding, for instance, nor with other drinking water quality issues. So it really, what I'm excited about is the practical end of this, because all the groups and experts we have here today to talk to you will say this is solvable, this is preventable. And that's our solution, is that we need to prevent over time, and there's ways to do that. So we're really pleased to have this toxic metal working group, and they're the groups and institutions that are convening this session. So of course, WHO, UNICEF, the University of North Carolina, World Vision, IAPMO, Rural Water Supply Network, and University of Leeds and WaterAid. So these are all these groups that are kind of coming together, and they're saying, look, all this complexity around practice, all this complexity around essentially analyzing, detecting lead in drinking water, surveying it, monitoring it, but most particularly reacting to it. What happens when you find that there's lead in your drinking water? Because this becomes a communication issue. Every kind of situation we've had where this has been kind of come out to the public, and there's many examples you hear about, everyone gets panicked. What does this mean? And so I think the object of the session and a new guidance document that my colleague Jennifer will talk about is that there is a calm, rational response to lead, just like any other contaminant, just like any other health risk. And there's actually fairly straightforward means to tackle this issue, to deal with it, to mitigate it over time, and to communicate it in an effective way to consumers so that everyone's comfortable that we're doing the best we can to reasonably reduce it and protect public health in the long term. So that's the idea, and I hope that's why you're here. And maybe if we could move to the next slide, I'll just give you a little bit of a kind of overview of the agenda. And maybe I'm the one who's supposed to do the slides, so I will not ask someone to do that. You'll see first a presentation from my colleague, as I said, why lead is harmful to humans, how we manage lead, how to take actions, proposed actions at country level, and then I think most kind of compellingly is case studies. How are we actually dealing with this in real life, and learning from those countries and people that are actually experiencing this firsthand. And then finally, I think it's great that we can have interaction with you in a panel discussion and questions and answers, because some of these issues really do lend themselves to questions and answers. So we have a great group of people. I'm happy you're here, and I'm going to pass it over now to my colleague Jennifer, who leads our drinking water quality management work at WHO.
Thanks so much, Bruce. So I'm going to start with the introductory part on why lead is harmful to human health. So we heard from Bruce that lead is a chemical of concern. It causes multiple health effects. The most significant are cardiovascular disease in adults, and even most importantly, the neurotoxic effects in children and in developing fetuses. Lead is also stored in the body, and it can become released from the bone into the blood that can become released to fetuses. So there is tremendous concern with lead because there is no safe level. So lead is measured, exposure to lead is measured in blood. And as Bruce mentioned, that lead, there's no safe level. And so low levels of lead in your blood is a concern. And we see this map, which shows the extent of exposure to lead in children. And so what does this map show you? Well, one, it shows you that at higher levels, the concern is primarily in lower and middle income countries. And the reason why in higher income countries, a big reason why lead levels in children have decreased to lower levels over time is because lead has been banned from use in gasoline as an additive. Now, in all countries since 2021, lead is no longer allowed for use in any country in gasoline. Having said that, there's many sources of exposure to lead. So this is actually misleading in that it is an issue in all countries, not just low and middle income countries, and particularly in higher income countries too. I mean, you've seen news about this, but also for lower income settings, they have higher risk of being exposed to higher concentrations of lead. So lead is used in many different products. And so there's widespread contamination of the environment. And as a result, there's many exposure sources to lead to humans, from inhalation to ingestion in our food, through paint, and because it's used as an additive in paint and batteries, etc. So all these sources of lead can contribute to exposure. And also included is drinking water, where lead is often used in pipes and materials in fittings and other sources of in distribution systems. So with that as a backdrop, as we heard from Bruce, lead is a chemical of concern, and it's identified by WHO as one of 10 chemicals of priority public health concern that requires action by member states. So we need to take action on lead. There's no question, including lead in drinking water. So as I alluded to, that lead has been in the news many times in drinking water. There's been news in high income countries. Many of you are familiar with the case in Flint, Michigan, in the USA, but also there's been headlines in other countries as well in lower income settings. And here's the example from India. So how big is the problem of lead contamination in drinking water? Well, we don't really know because there hasn't actually been a lot of testing in many settings, including in sub-Saharan Africa. And so there have been some recent papers on lead in drinking water. This is an example from UNC, which we heard is part of this toxic metal group, where there was a study recently where they looked at 3 countries in sub-Saharan Africa. I think they found about 10% of samples had lead exceeding the WHO guideline value. And where there are many components in lead had lead concentrations above what we consider to be low or lead-free concentrations. And I think that's supposed to be 0.25% lead as components in water supply system. So this study is illustrating that lead exposure is potentially significant based on this one study, but more research is needed to really understand the problem and also to help in identifying what are the solutions. How can we address this problem? So because of the concern with lead has been included in WHO's drinking water guidelines since 1993. And so we have a guideline value for lead in drinking water. So a WHO guideline value is a value that's considered a point of departure, a starting point for countries to develop, to include in their national drinking water standards to help provide a benchmark of what is considered safe. Lead guideline value in the WHO guidelines used to be based on health effects information, based on the WHO FAO provisional tolerable weekly intake established by this committee on food additives from WHO and FAO. But that PTWI, as it's called, was withdrawn And as a result of that, the guideline value from WHO was not considered to be based on health. And as mentioned, it's now based on practical considerations. When you have lead containing materials in water, it's very difficult to have zero lead in your drinking water. And so the guideline value is still maintained at 10 micrograms per liter, but it's considered provisional because of these practical concerns with achieving lower levels. Having said that, if you can achieve lower levels, then you should. So, all efforts should be made to prevent lead in new drinking water in new systems, but we need to consider the practical constraints as well. Also, lead is one of many contaminants in drinking water. So we cannot consider lead in isolation. It needs to be considered in the context of all risks within a water supply, as well as considering the risks of other exposures of lead in the environment. So as I alluded to, lead, the primary source of lead in drinking water is really its use in materials in contact with drinking water. So service lines, faucets in homes, and solder, etc. Because of this primary source of lead, so there are other sources, but this is really the key source, it presents challenges for monitoring and managing lead in drinking water. And because of that, there were questions about how do you actually take action? What's the best way to monitor? Because different monitoring protocols has implications for how you would interpret what's in your drinking water. And so with all of that, then countries were asking, how do we go about this problem? And there needs to be a systematic approach. And so with this, we developed this technical brief on lead in drinking water. So this document, you can take this when you leave as well. We have just published this today. So this is the first group getting this, and it provides practical guidance to support the assessment and management of lead in drinking water. So with that, I'm going to turn it over to my colleague, Johan, who is the lead author of the brief.
Thank you, Jennifer. Yeah, lead in drinking water, you don't want it there in the first place. And that's why we put prevention on top of this upside down triangle, trying to prevent it in the first place. Use the right materials and do proper installations. But if we end up in a situation where we can't change history, then we must deal with it. So that's the focus of the technical brief. The technical brief is out from today, and by using this OCR code, you can hopefully download it to your own cell phone. I'm going to give you a short overview of the contents of the brief. Firstly, to come to a conclusion or a solution, a sustainable solution and management of lead, it requires a lot of information and some decisions to be taken, often in larger groups. So we suggest a process for you to stick to that will enable you to take this sustainable decision. Secondly, lead is very difficult because it varies over time. In one tap, it can vary tenfold concentrations. So it's not the sampling that's difficult, but catching the right concentration, the representative concentration is difficult. So that's why we have included a section of a number of sampling protocols and a number of sampling strategies that you can review. The best strategy depends on the situation and the questions that you ask. So that's why we're not saying that you should use this explicitly. Another difficulty of lead is that it's involves many stakeholders. Sometimes it requires action from all of them. both property owners, consumers, and service providers, or the authorities. So that's why communication is very, very important in these projects. Also, as Bruce mentioned, many of these cases around the world have drawn a lot of negative attention. And we believe that communicating the right things at the right time will help you not end up there. We also provide an overview of the known sources. It can be metal, lead, of course, but also lead-containing alloys such as brass, but also PVC. And of course, we have in some cases geogenic or pollution. But also, if you put different metals in contact with one another that shouldn't be, you can end up having galvanic corrosion. So that will catalyze this reaction, resulting in even higher concentrations of lead than just bare metals. And lastly, is there anything we can do about this? Yes, there is. There are a number of measures that you can take, and most probably our message is that most probably this will take some time, and you will require both short-term and long-term solutions, central or consumer-based solutions. So we give you an overview of these solutions, describing the pros and cons of them all. So we've tried to be brief, but rather fact dense in this technical brief. And yeah, it's out now. You can download it from here. And with that message, I would like to hand the mic over to Jorge from UNICEF that will speak about the actions that we recommend you to take.
Thank you, Johan. So in this section, I will briefly introduce the work that the Toxic Metals Group has been doing over the last few months. We've been collaborating with WHO in the production of this technical brief. And here you have a summary of the global actions that we as a Toxic Metals Group are proposing to do and are planning to do in the near future. So the first action is to increase knowledge of the problem. There is still a lot that we don't know, and there is still some research that needs to be done. In particular, I would say country by country, we need to understand better the context, the sources of contamination, etc. The second area is on promoting advocacy and awareness raising. This is one of the reasons why we're organizing this session today at the World Water Week, because we believe that this is now the time to communicate to the world that lead seems to be a much bigger problem than what we thought before. The evidence is, I believe, stronger now in both developed countries, in both rural and urban areas. So it's really a global problem. The third point is on supporting the elaboration of country plans. The Toxic Metals Group includes organizations like WHO, like IAPMO, that work on normative on norms supporting countries. We have organizations like UNICEF or World Vision or WaterAid that work directly implementing in the field, that can show how can you practically address these issues, and also works with academia like the University of North Carolina or the University of Leeds that can help us in this research. So I believe that the Toxic Metals Group is a nice group to to discuss, but it's also a nice group to consult in case countries have specific needs and questions. So we have a joint communication strategy. As Bruce said in his opening remarks, this is often a sensitive issue, so we need to make sure that we are communicating well. We don't want to create unnecessary alarm to the public, but we want to create some alarm to the decision makers so they can react accordingly. And also we want to work with manufacturers, with the industry, and we want to work with governments on adjusting the technical specifications in the countries. So there's, for instance, an ongoing effort between the industry and the ASTM International to develop international standard on this area, and also with other bureaus of standards like the Indian Bureau of Standards, on adjusting the technical specifications and the limits. So this is like from a global perspective on the work that this toxic metals working group is trying to promote. In this part, I will just give a brief introduction to the recommendations that we give to each of the different stakeholders at country level. So the first set of recommendations are targeting governments, government officials, authorities responsible for protecting the health and well-being of its population. The first recommendation and key recommendation is to take lead on lead. Governments are responsible for this. So it's not up to the Toxic Metals Group or up to WHO or UNICEF or in the different organizations that are part of this to lead this agenda at country level. Governments need to own this agenda, to inform users, service providers, contractors, and to coordinate the different stakeholders. We recommend to expand surveillance and investigation to understand what could be the sources of contamination. In some cases, it could be geogenic, as Johan said in his presentation, but it could be related with the quality of the materials or the type of materials that we put in the service provision. We need also to provide, or we expect, or we suggest governments to provide guidance to the sector. So to orient the different stakeholders in the sector on what they need to do from the side. Our suggestion, and you will find some good recommendations in the technical brief, we suggest to adjust the technical standards, the lead standards at country level, and to start implementing no regret measures. There are some quick, low-hanging fruits that governments can implement that can have an impact not only in lead at the moment, but can have an impact on ultimately the water quality that is being served. We suspect that low-quality materials being used at the moment in many countries could be, at least in some countries, could be elements that we need to take further consideration. Enhancing control mechanisms on infrastructures, government-led infrastructures, but also encouraging that other stakeholders kind of do internal control, and doing systematic water quality testing for new water points. So we need to make sure that at least the new water points that we are commissioning to communities have safe lead standards. And last but not least, we believe that this is something that is a long-term agenda, and we need to contribute to the progressive replacement of components that could contribute to lead contamination. This is a good example is in Europe or in the US, where there are still old lead pipes in many households, and this takes, we believe, that too long time, but we need to make sure that those elements that are contributing to contaminate water nowadays are progressively replaced. Some brief recommendations to service providers. You need to identify and document where lead-containing materials are used as part of a water safety planning. It is also important, as I mentioned earlier, to use certified materials following national requirements and to control the quality of those materials. maybe including a clause in contracts that specifically refers to lead and specifically instructs the suppliers to provide evidence that the materials, in particular those that could be problematic, that contain a concentration that is below the international or the national standards. I think Johan already mentioned some of the suspected materials. Hand pumps was highlighted in one of the UNC reports, but also we believe that galvanized iron pipes, PVC pipes in many countries, although there are international standards that prevent from adding lead as a stabilizer, in many countries we find low quality, cheap pipes that contain too much lead and could potentially contaminate water. Reducing the potential lead exposure by temporarily procuring safe materials. Sometimes it's more expensive to procure those materials, but I believe that is in the long term much more expensive to replace pipes that are lying on the ground or in the piping system in the households. A corrosivity of water, as Johan mentioned earlier, is also an element that needs to be considered as part of a kind of a larger problem, but as part of something that could contribute to the release of lead in water. And using high quality materials, incorporating lead into existing surveillance and systematic testing of water points, as well as expanding or making sure that the water quality testing plans include lead. In many countries, we find that there is bacteriological contamination, there is, testing for bacteriological contamination, for arsenic, for fluoride, but lead is not always included in this kind of in this water quality test. And as we recommend to governments, service providers also can and should play a key role in the progressive replacement of components that could contaminate water. Briefly, recommendations to contractors, I think are a bit of repetition, but I think it is important to specify what each of the groups we recommend to take action on. Specifically for contractors, it is important to test lead before commissioning any works. I think if governments, if different stakeholders are going to encourage and test lead, I think it's better for contractors to be protected and make sure that they are doing the right thing in the first place. Using alternatives to lead-containing parts, separating different metals or alloys from each other, as we mentioned earlier on corrosion, etc. Using higher quality materials where water is corrosive. This is particularly important. There is a campaign called Stop the Rot that highlighted the problem of corrosion, which is quite widely spread in sub-Saharan African countries. Using certified materials, following national requirements, and requesting suppliers evidence of the quality of materials, as well as using certified subcontractors. For external support agencies, we recommend external support agencies to advocate and guide and support government counterparts. We also encourage for those financially supporting the construction of infrastructures to request evidence of lead concentration below the national and international standards before commissioning those infrastructures to the communities, and to support the government efforts in prevention, mitigation, and remediation. Last but not least, the recommendations to users, including following the guidance from governments and service providers. If lead levels are too high, there are some recommendations. Of course, it is very difficult to provide specific recommendations because obviously this technical guide aims to reach all countries in the world. So it depends on a country by country, on a case by case. But there are some easy measures such as flushing the tap for a few seconds before drinking water, installing a filter, or using an alternative water source for drinking water. Replacing the lead-containing components at household level, and always hiring qualified professionals for installations at household level. I will now pass the floor to my colleague Claude Ramseyer, who will continue the presentation on our behalf. Claude, I hope you are there and the connection allows you to talk. Claude, over to you.
Thank you. Hello, Stockholm. This is a lot of information. Let's try to summarize. We have a problem, not only a health issue, but also a reputational one by installing and using lead-releasing materials. So we have to act. We have to act by including lead in our drinking water monitoring, by checking that the materials used are compliant, by investigating where needed. And even if we need more evidence, we need to act now. And we have the solutions. We can communicate and coordinate so we have everybody on the same level and we can go forward. We can improve the drinking water safety by including lead. And we can use no regret options such as stainless steel, for example. We can replace the problematic materials, risk-based, and there are several remedial actions, interim and long-term. We can find that in the technical brief. Next slide, please. On the next steps, the French translation on the WHO technical brief will be out soon. So we have it in 2 languages. The technical side event during the UNC Water and Health Conference will be in place. And then there are some targeted seminars to help people to find out solutions. The help desk, WHO, UNICEF, and others is of course completed by the TM, the Toxic Metal Working Group, which was explained before. And if some specialists want to join, they are welcome. And of course, we can support projects if projects need some support from our side. That's it. Next, I thank you for your attention and I pass over to Ray for the case studies.
We're going to look at a few case studies from different places, from different people. We're first going to hear from Samuel Diarra. Samuel, I hope you're there. Samuel Diarra is our technical director for quality and innovation at World Vision International. He's going to talk about some technical responses that we took to addressing the lead and water issue. So Sam, over to you, sir. Can we hear from you?
Yeah, thank you very much, Ray. World Vision is a Christian relief and development and advocacy organization. We are dedicated to work with children, families, and communities to overcome poverty and injustice. At World Vision, we believe that every child deserves clean water. Next slide. We align our work in WASH with the aspiration of SDG 6, believing that we can provide safe water to everybody where we work. Actually, we work in 46 countries with our WASH program, and we reach about 2 million people with safe water every year. Next slide. We came to know about the lead issue during the 14-country evaluation that was undertook by UNC and World Vision in 2017. And during this evaluation, we got some reliable data on trace metal in 4 African countries. And those data are showing about 9% of our samples exceeding the WHO standard of 10 microgram per liter. And this happened in March 2019. Then this study highlighted that the potential source of lead include brass and other uncertified material used by the sector. Then based on that, World Vision provided a technical response. And this response included the development of an internal supply chain and procurement guideline. And this guideline required for every office to use certified material for constructing water facilities. And this guideline has been widely published. We had workshops, seminars around it. The second aspect where we focused was to update our water quality testing protocol, not testing only microbiological content, but also trace metal and major element as well. So this quality testing will help us to identify the problem, and then we can also use the supply chain and procurement guideline using exclusively certified material to prevent the problem. Having these 2 materials in hand, we decided to train our WASH people, our supply chain team, and also our audit staff on those new guidelines and protocol. And the aim of that training was to let them be aware of the issue. The second, to know the component of the issue and the requirement, and also to work together for WASH people to ascertain that in our supply chain system, in our procurement system, we consider the certified material since inception till the reception of the goods, and even after the installation, to ensure that we are not creating a new problem with lead. Supply chain people to embed this, the certification material consideration and the specification in all the process till the end. And then the audit staff to be some kind of stand by our side to check if countries are complying with those 2 documents. Next slide. By doing this, we met some challenges, and I want to share some of them. The first is the cost increase, because usually we were purchasing material from the available suppliers in low and middle income countries. But when we increase the quality, the standard, it is not obvious that we have suppliers in situ able to provide them. So they need to order those materials from outside. And this increase obviously the cost, because the quality also has increased. By doing that, we increase as well the time of purchasing those certified material, because they are mainly outside the countries where we work. And the last element I want to emphasize on is the quality laboratory lacking in many of our countries. For us to check for lead issue, we need really a well-equipped and standardized water quality labs to be able to ascertain the problem, which is not always obvious. So these are the 3 key problems we have met in our implementation of remediation and prevention process. Thank you. Back to you, Ray.
Thank you, Sam. We're now going to hear from Dr. Orlando Siabi. We have a short video here. He is the Chief Executive Officer for the Community Water and Sanitation Agency in Ghana. He also serves on the boards of the Water Research Institute there, the Water Resources Commission, and the Ghana Standards Board. As you've heard from several presenters earlier, we feel that it's really important that governments take the lead on this, especially for we implementers such as World Vision. We need the national governments to take the lead, and we will support and, of course, follow suit. And we wanted to share with you an example where that is being done, and that's in Ghana. CWSA, the Community Water and Sanitation Agency under Dr. Siabe's leadership, really is a clear example of a national government entity among LMICs that is taking proactive and transparent steps to acknowledge and to better understand the challenge of trace metals in their water systems. And they're actively demonstrating leadership in the search for preventive measures to mitigate the problem and, of course, to remediate. And I want to mention before we play the video that Dr. Siabe, back in 2019, when we first got the data from the UNC study, he hosted a meeting in Accra of 4 national governments, invited people from the Ministry of Water to come and develop action plans on how to address the trace metals issue in their countries. And they developed a standardized action plan. Part of that was to host stakeholder meetings in each country. So they developed the action plans. Ghana hosted that, another country. So we had several countries hosting stakeholder meetings to try to elaborate on the trace metals issue and to try to get people, WASH and water stakeholders in each country to really start thinking proactively about how to address the problem. Dr. Siabe also in 2019 attended the RegNet, the Water Regulators Network meeting at the WHO to share about Ghana's experience, to talk about the actions that they intended to take. And of course, he is now working with World Vision and the Water Institute at UNC to launch a 2 to 3 year study in Ghana, which will start this year. And you will hear him talk about that in his short video. So let's play that video.
My name is Dr. Olanyo Kwajo Siabe, and I am the Chief Executive Officer of Community Water and Sanitation Agency in Ghana. Ghana is blessed with a lot of groundwater resources, but we have noted that as much as 30% of these resources will have challenge with water quality, and particularly we have issues with trace metals, iron and manganese in the highlight. Recently, there has been a study by World Vision Ghana and also University of North Carolina. And we have noted that lead is also one of the trace elements that are showing up in these drill wells. We have close to 40,000 of boreholes fitted with hand pumps in Ghana. And having this challenge implies that a lot of our communities who depend on these facilities will be exposed to the risk of using water contaminated with lead. And therefore, it is a worry to us. And so Community Water and Sanitation Agency has become really interested in this research. And so we will collaborate with World Vision International and University of North Carolina to see how we can come to conclusions on how to deal with this lead menace. I want to appeal to all governments and our partners to World Vision International, University of North Carolina, and many other partners to become part of this collaboration so that we can carry out further studies into the levels of lead in the ground, especially in communities where we use hand pumps. We believe that this study will be very useful, not only to Ghana, but to the sub-region and to most developing countries. So everybody is invited to be on board so that we can find a solution to these trace missile problems. Thank you.
Wave Beats Music.
Lastly, on our case studies, we're going to hear from Jeffrey Kempick. Jeffrey works for the Environmental Protection Agency in the U.S. Many of you know him. He is affiliated with the Standards and Risk Management Division of the Office of Groundwater and Drinking Water at the EPA. He spent about 35 years working with drinking water regulation in the U.S. He's a member of the team that first developed the final lead and copper rule in 1991 and has been involved in subsequent revisions of that rule. So we're now going to hear from Jeffrey, and you want to help me here?
All right. My name is Jeff Kempick. I'm going to be talking about some key elements of the EPA's lead and copper rule and lead-free rules that we have dealing with lead in drinking water in the United States. The lead and copper rule is a very complicated rule, so I'm just going to touch on some key elements that were changes as a result of these lead and copper rule revisions. One of the first deals with the monitoring that's required under the lead and copper rule. For the U.S. is a bit different in terms of the structure we take in terms of doing the tap sampling. Basically, we're looking at targeted tap sampling, looking at sites that are likely to have lead in them and potentially higher levels of lead when you take samples at the tap. So for systems that actually have lead service lines, water service being provided through a lead service line, there's a requirement under the lead and copper rule that 50% of the sites need to be served by a lead service line. And then the other 50% would be sort of the other, what was deemed high risk at the time, which was the newest lead solder, which was typically, depending on the state's acceptance of the lead ban, somewhere in the range of 1983 to 1988 would be the ages of these homes. For these, we're taking a first liter sample, so the water that's in contact, no flushing, you immediately take the water after a minimum of a 6-hour stagnation time, and those are the samples that are analyzed to deal with whether the system is meeting the action level. For lead, we use a 90th percentile, which means that 90% of the tap samples need to be below the 15 part per billion action level. You also established a lead trigger level. As I mentioned, we have the lead action level, which is the 90th percentile at 15 micrograms per liter. We added a new trigger level at 10 micrograms per liter. This is not a health-based standard, nor is the 15 part per billion a health-based standard, but it's a reasonable concentration below the action level to require systems to take some actions to reduce lead levels. We have some goal-based lead service line replacement programs. There's outreach to customers to try and convince them to participate in those goal-based programs. And then probably the most significant part deals with systems that do have corrosion control in place. They need to re-optimize to try and get below that 10 part per billion trigger level. And then the way the lead and copper rule works is that systems would only do the studies after they exceeded. There was concern that because these systems are fairly close to the action level, let's have them figure out what they would do if they potentially would exceed it, so that if they do exceed it, that they can implement the treatment immediately and get levels back down lower quicker, rather than having to do a study which could take an additional 2-year period. Some other things: systems above the trigger level must monitor annually if those tap samples are being collected once a year, and systems above the action level monitor every 6 months. As I mentioned, we published this rule in January of 2021. We had a significant review that was conducted pretty much throughout the entire 2021, and we published a notice in December of 2021 indicating that we intend to propose and finalize a new national primary drinking water regulation for lead and copper, the lead and copper rule improvements to build upon some of the lead and copper rule revisions requirements. And sort of the key areas where we're looking at making revisions to this rule by 2024, October 2024. Big one is replacement of all lead service lines while equitably improving public health protection. So replacing 100% of lead service lines to protect Americans from the significant source of lead in drinking water systems, and helping people who can't afford to replace their portion of the line get that replaced. There is, in November of 2021, the bipartisan infrastructure law passed that allocated $15 billion over a 5-year period, so $3 billion a year, basically to get a good down payment on this. In the US, we estimate that it would cost about $50 billion to replace it. And then some of the other ones are dealing with potentially looking at modifications to the tap sampling protocol and reducing complexity associated with that trigger level and action level. In lead free, we've got requirements that from the act that talks about 0.2% lead for solder. We've revised the act has been revised over the years to modify what allowable lead in brasses and bronze. It was originally 8%. Then there was a leaching requirement that was imposed. And now, after the reduction of lead in drinking water act, it's 0.25% based upon a weighted average of the wetted surface area of the fitting and fixture. And the next thing, 2 slides, are basically an example of how this works. So we're looking at the wetted surface area of each of the components in the faucet, and then coming up with a calculation. And as you can see, some of the components themselves might be higher than that 0.25%, but the actual product, the fitting fixture, is below at 0.23%. So that's sort of an example of how this process works with the weighted average of the lead content calculation. So that gives you an overview of the key elements of the lead and copper revisions, also some idea of some of the areas where we're looking at making some additional revisions to that rule, as well as some of the lead content from the lead free definition as it relates to brasses and bronzes. Thank you.
Now we're going to move to our panel discussion. I'm going to turn it over to Dane Hansen with IAPMO.
Thank you, Ray, and thank you for everybody to be here. Now we get a little bit more of the engagement side from everybody, and we're excited for that. So we will start calling up the participants of the panel. So Christopher Lindsay with IAPMO, Ray Norman, again with World Vision, Jorge, who we've seen before, already speaking today, will join us, and Jennifer DeFrance as well from WHO. And we're excited to have this group with us. And I'll start it by saying, this working group established several years ago. I still remember many, many years ago, we got together with WHO, UNC, and many others on this. This is, before this was really a major, we've known this is a significant issue, but we didn't realize the crisis it was coming to until just a few years ago when we all decided to get together. I think it was before one of the UNC Water Institute meetings, really started to put our brains together and figure out how to manage this issue. And I do want to recognize Aaron Salzberg. Are you there, Aaron? He's also one of our panelists as well from UNC. So he's calling in early in the morning in the States. I just want to make sure he's
No worries,
a part of this.
Dane, I'm there.
Great. Well, thank you for joining so early. So a little bit, every person that you've heard to today, has played a significant role. Many of you are probably asking, who is IAPMO? So IAPMO, we're about a 100-year-old trade association based in Washington, D.C. We represent, a lot of the plumbing industry in terms of code standards, specifications, which go into products and standards, and also the training that may go into some of the contractors that do the work. But a big part of it is also the certification and testing of products. So all the products that you may come across in your home, fittings, joints, solder, showers, pipes, pumps, they must be certified in many cases. And this is what we do, and this is what we specialize in. So I just wanted to give a quick recap because I'm sure it may not have been a household name for many of you. So to start, and I open this up for everybody, but I'll start working my way down. And but for Christopher, I guess for you to start, what is the role, being from IAPMO, what is the role technical standards for low lead components play in this, and would they solve the problem?
We heard a lot of talk today about internet, standards, in this space. And I think from our perspective, kind of representing more kind of the industry voice from, the manufacturer perspective, the regulator perspective. For us, standards is the international language that industry uses to communicate. I appreciated what Samuel had to say about the challenges that they faced about sourcing lead-free products, in the market. And where does an organization like World Vision begin with, changing the marketplace so that no longer unsafe products are, pervasive in the market and that lead-free products are there. And, that's really where the kind of the standards come into play, because, that's how we communicate with international manufacturers. That's how national governments set their expectations for what safety of products is going to be allowed in that marketplace. And that's how, both domestic and that's ultimately how end users get, safe products in their hands. Because with this issue, it's pretty impossible for an end user to be able to tell what PVC pipe or which a component of a system has lead and which one doesn't, right? You can't just tell by looking at it. And so that's why I think we need to do a good job about taking advantage of industry processes that are in place that, protect us in a lot of different sectors. And, for us, use of international standards for lead-free type products is the beginning. That's a starting point.
So you mentioned Ray, and Ray spoke earlier, and I wanted to bring it to him really quick, kind of a two-part question, if you will. So how and why did World Vision ultimately first get started? We heard a little bit about from the earlier presentation. So I guess what was the impetus for this? But then also, what are some of the lessons learned in dealing with this on how you communicate the issues of lead in drinking water with other stakeholders? And what would you suggest how to handle this in other countries moving forward?
Well, some years ago, World Vision funded a 14-country evaluation of our global WASH programs. Most of those countries were in sub-Saharan Africa. One of the outcomes of that study that was conducted by the Water Institute at the University of North Carolina was that we seem to have a lead problem in some of our systems. Now, the evaluation did not cover just World Vision boreholes. It covered the entire sector. So the data represented the sector, not just those implemented by our organization. So when we got those results, the first thing we did was we took the information to the ministries of water in the respective countries where we work. And we always work very closely with the ministries of water. We wanted to sound the alarm, but not in an alarmist way. I think someone else addressed that earlier. So we quietly took the information. We said, listen, this is the preliminary data. This is what we see. We need to do more research, but we'd like to bring it to you first. And we encourage you to take the lead on this. Governments need to lead. And that was our message. That message was met positively by some governments. You heard from Dr. Siabe. Other governments were a little bit more reticent because of various risks involved in talking about lead. So we tried to communicate. We also worked with our staff. We worked on communications briefings, how our staff can articulate this and talk about it, especially with government officials, in a very informed way. So it's very important for your staff to be able to talk, your water staff to be able to talk about this in an informed way that doesn't alarm, but really motivates, especially local governments, to get involved, to engage. And part of that is also communicating to local governments about the importance of post-implementation monitoring of water systems and water quality testing, and the whole issue of laboratories is a big issue, and trying to get those conversations going. So those are kind of the actions that the non-technical actions we took. You heard the technical actions that we took about revising our supply chain procurement policies, updating our water testing protocols. But on the other side, we've really worked to start with working with national governments, and we intend to continue that.
Thank you, Ray. I think it's a good point to raise, because this is an achievable goal to address lead contamination. It's something that can be done, but it takes work. We've talked a lot about some of the daunting things that we're facing in the water space, but this is something that is manageable. I want to jump over to Aaron, keep him awake online. So Aaron, from the UNC's perspective, who's been involved in this early on when this first started, what are some of the challenges in understanding lead contamination in drinking water that you see, especially considering all the other sources of lead exposure, impact on health, water quality test results, and on and on?
Yeah, thanks, Dane. No challenges staying awake here at this end. It's a great session. And thanks for UNICEF as well for helping to put this session together on such a critical topic. And maybe just a couple of other quick shout outs to the WHO for its new technical guide, and the partners that worked on that. I think it's a fantastic product. As Bruce mentioned, I still think that there's a lot of science to be done around lead. And many of the partners within the room are working to advance lead research. And I do want to acknowledge World Vision's work right now from Dr. Siabe and others to sponsor research in Ghana. I mean, it is an issue that we don't fully understand. And this research is critically important. So it's wonderful to hear that there are partners that are stepping up to do this kind of work. Maybe I'll just highlight a couple of areas where I think some additional research would help better inform our decision-making around how we manage risks around lead in drinking water. And maybe first is, and I think Jennifer got to some of this, is understanding the sources and the processes that lead or contribute to lead exposure. Lead can be in soil, air, water. We need to track down the sources, understand what factors might influence exposures. Many of these exposure pathways are tricky. In water, there are a lot of factors and processes that can affect the amount of lead present in the systems, how fast it may leach from the pipes and the fittings, including the influences of source water composition, materials within the system, other environmental factors, perhaps even climate change. Understanding these causes will allow us to better understand the risks and lead us to better preventative measures. I think the second area, which ties a little bit to that first, is to build the capacity for rapid, low-cost, reliable testing in different settings. Johan pointed to this. While we have some laboratory methods that are available, these can require significant capacity to implement effectively. There's a real need to build capacity across the world and to leverage these methods at scale. In addition, there may be opportunities to identify and evaluate and deploy low-cost, effective technologies that will support the high throughput screening for lead in water and water system components by field staff. But the reality is that every system we install, every system that is installed should be monitored for lead. How do we do that in a cheap, inexpensive way? How do we develop those low-cost technologies that will allow folks to be able to do this in the field and to get, a response quickly to the testing that they're doing? That's going to be really important. Third, I think we need to develop, pilot, validate prevention and remediation methods. We heard about a number of these steps, particularly in rural water supply systems. This was Bruce's point at the beginning. Primary prevention is likely the best way to reduce lead exposure. And that means preventing lead-containing materials from being used in water systems, which should be the main focus of our efforts. There are also another additional options for remediation. Jorge mentioned a few: replacing or coating lead-containing components, filtration, adsorption, corrosion control technologies, even flushing, which may provide some more limited relief in some settings. Many of these approaches have been validated in community water systems in high-income countries, but their adaptation to rural water systems in low and middle-income countries hasn't been well established yet. And so that's an area where a lot of work needs to be done. Finally, one additional area I'd prioritize, we need to assess the health impacts. And Jennifer made this point, at the end of the day, our job is to progressively improve the quality of our drinking water supplies by addressing key risks. We need to know how lead in drinking water is impacting people in different settings with different environmental, nutritional, and developmental situations. We need to measure blood levels and better quantify health risks of current exposures and the benefits of these prevention and remediation steps, all within the context of the other health risks in water and beyond. So that we can make informed decisions about how we achieve the greatest health impacts. And that's critically important. Now that said, I mean, I think I'd be a little bit remiss if I didn't make this point. Bruce and Jennifer made the point that, lead is different than many other contaminants. There is no safe level of lead exposure. The impacts of lead, particularly in children, are profound and permanent. And so reinforcing the point that many have already made, I don't want people to think that more science and data is necessary before we act. We know that lead is common in rural water supply systems throughout the world, and that there are simple, proven solutions to preventing and reducing exposure. Existing standards do exist for helping countries and implementers to ensure that water systems and materials are safe with respect to their lead content. So I'd urge that we should work to learn while doing, and that partners step up and support the science, and at the same time, take these immediate actions to institute policies and practices now to reduce lead in component parts, within these systems. I mean, it would be a mistake to wait. So back over to you, Dane.
I think you raised a good point. I don't think we want to sit and wait until there's more data or wait for more information to do anything. We know that's an issue. And Aaron articulated it well that we know that there is no safe lead level. So Jennifer, one thing for you, I mean, you've noted in the past, and first of all, I'm super excited about the report, the technical brief. I think it's important. It's something that we've been very vested in over the years and interested in pushing and supporting, and we're already ready to scream it from the rooftops of that this has been published and is out there. One thing you've noted is that, and Aaron even mentioned just now, is that there's no documented safe level of lead currently. So many people are thinking, so should the advice be that we just get rid of anything containing lead and all lead materials now?
Thanks, Dane, for the question. So it wouldn't make sense, I don't think, for WHO to make that recommendation because it's not feasible. And so we say progressive replacement, recognizing the costs for replacing pipes. So you heard the figures from US EPA, Jeff, just like billions of dollars that the US is investing in this. At the same time, there's all the logistical challenges in removing pipes. I mean, that's going to take time in itself if you have the financial resources, because you have to dig up roads. A lot of the issues are actually in people's homes and getting the consumers to cooperate as well. So there needs to be this progressive replacement. Ideally, it would be a progressive replacement focusing first on those that are at the most risk. So looking at schools, looking at where there's children, but that's not always feasible either. And you might need to be opportunistic where maybe the roads are being dug up, but it's really about the progressive replacement. And there's an example in the lead technical brief about, for example, the city of Frankfurt, where they decided that they were going to replace their lead pipes. And that took over 10 years to do that. So it really is a long-term thing. Now, having said that, the good news is even though this is going to take time and there's no safe lead levels, there's so many interim solutions that can be taken. So to re-emphasize that action can still be taken if you have lead containing materials. So you can do, as Jorge mentioned before, there are other options for flushing, for corrosion control, for filters in buildings and homes, etc. So there's a variety of different control measures that should be considered. It's a multi-pronged approach to address this lead issue. If I may, I'd just like to touch on one thing about the communication part. So just adding on what Ray mentioned and reflecting on some of the other comments. So because lead in drinking water should be considered in the context of other lead exposure for communication, it's also can be very helpful for government, so for the water authorities to also involve the health authorities. And in the communication for health authorities to give an authoritative voice as well and talk about other sources of lead and the need to holistically address lead issue. And also because when you find a lead issue, it's likely going to take time to address it. It's likely going to require more investigation to really understand exposure, to understand the sources. So the communication isn't just one-off. It's going to have to be multi-step, and it's important to communicate and give updates, giving information about what's known, what you're going to do next, and also hearing from consumers and other stakeholders what their concerns are and tailoring your approach to based on the feedback they provided.
That's a great point, Jennifer. I think, communicating with the communities that we're working within is absolutely vital. Even in developing countries and developed countries where even US EPA said for them to replace the US lead service lines is going to take many, many years and billions of dollars. And that's not feasible in many, many places. We know that. So what do you have to do now? So I think Jennifer raised a good point. There are very quick interim ways to do it. Some filters quickly can take care of it. There's different remedial measures. So Jorge, with all your experience, what is the role of other international agencies and other NGOs that support countries to improve their water supply globally?
Well, I think there are two angles on this. One is the work that agencies like UNICEF, WaterAid, World Vision do in their day-to-day in service provision, in the contribution to increase coverage across the world. And then there is also, let's say, the upstream work, the systems strengthening, the supporting building capacities, building local capacities. In both cases, my suggestion for external support agencies is to take a proactive role on this in both ways. I mean, in the provision of services, because there is a reputational risk linked to it, but also supporting governments, because at the end of the day, we cannot work in isolation anymore. So we need to work in both, let's say, in both streams, supporting governments and also making sure that the infrastructures that we develop, that we support, that we rehabilitate, do not contribute to make the problem bigger. And I mean, I still hear the echo of EPA on the $50 billion bill is like, oh my. We should not stop by the magnitude of the problem. In some countries, the problem might be big, might be the result of decades of doing nothing. That's why, to me, it is important to start doing something, even small, now. So I think this prevents the 50 billion bill at the end, but also to work gradually. And there are many low-hanging fruits that we can address immediately. I mean, changing a technical standard is something that costs little, I mean, almost nothing. And it can make a remarkable difference in, changing the standard. You change the materials that arrives to the market. You do a little bit of quality control, and then you can change remarkably hopefully the new systems that are being built. So let's not be stopped by the magnitude of the challenge in some countries. Let's look at what can we, how can we collaborate together? And I think external support agencies can play an important role in kind of, in catalyzing change, in working closely with governments and working together as multi-stakeholder alliances at country level to durable change.
Thank you. I love the message that's coming across the panel now. Like, there is something that can be done, and it's a massive problem, but there's small steps that can be taken. And Jennifer raised a good point. Like, you can't do it all, but you have to do something. And look at the vulnerable populations. Look at those who are most impacted. The elderly, the youth, the kids, the preschools, the daycares, things like that will have a tremendous impact immediately. I do want to open it up before we go into another round of questions to the audience. I want to be able to have engagement and have a discussion here with you. So is there anyone in the audience here that would like to raise a question? Yeah.
Good afternoon. My name is Manoj Kumar Singh, and I am from state of Uttar Pradesh in India. I have 2-3 small points, but before that, I would like to thank all the panel members and all the presenters. It was very informative. Thank you. Like, first question, you showed about high presence of lead in India. Is it based on and you also mentioned that it may be because of lead in fuel, which was allowed till of late. So was that figure based on water sampling from all part of India? Or second point, all these materials, brass and GI, PVC, they are the commonly recommended material for laying the water system, drinking water system. And we are in the process of implementing a project, we call it Jal Jeevan Mission. In state of Uttar Pradesh, like in next 2 years, we'll be providing tap water connection in almost 30 million households. So it is under implementation. So I think it can be the right stage or most suitable stage to take cognizance of these issues. But you mentioned like simplest thing is to change the specification, but what follows after changing the specification? You need to have that manufacturing ability. Your manufacturer need to be able to do that or bring those material in market. It's not so simple. Like changing things on paper is one thing, but getting it done on the field is entirely different thing. So I'm quite confused that why these materials were so commonly recommended when they are so problematic. Thank you.
Sounds like a good question for Jennifer and then Christopher, I guess, on standards over there.
Oops, sorry. That's a good question. Let me start. I think you referred to the picture that Jennifer presented on. Oops, sorry. On concentration of blood of lead in blood sample in children. I mean, this is I would say the peak of the iceberg. There is a recent countrywide analysis in a high middle income country where as much as 1/3 of children had lead concentration levels above the recommended. I mean, there is no safe level standard, but above what we would consider as, let's say, acceptable. 1/3 of children. And we don't know yet why this huge amount of children have such a high concentration of blood. So that's why we go back to the first point on we still need more research. Most likely, I mean, the good news is that most likely it's not water or not only water. I mean, there are other sources, other contaminants that are present in the environment that contribute to these very high levels of lead. But to the point on the case of India, I mean, I think is quite interesting because one of the research studies put emphasis on hand pumps. And India is a world leader in manufacturing hand pumps that are installed all over the world. So if the problem is identified in West Africa, chances are that the same types of hand pumps with low quality materials could be installed today in India and in other parts of the world. And I agree with you that it's not just about changing the standards; it's also about working with the industry and working with those manufacturers that are producing not exactly meeting the standards in the country to convince them that is a problem for the whole industry. I mean, if the message that organizations like World Vision, UNICEF, or governments receive is, hand pumps are problematic or could be problematic, there is a chance that implementers are going to shift to other technologies. So I personally had these discussions with 3 of the main Indian manufacturers a few months ago, trying to explain them you need to work with the Bureau of Indian Standards, and actually we're working together with them to upgrade the standards, the national standards, and they're working currently on this. But also we need to talk to the industry, to the manufacturers, because it's not that changing a standard immediately is going to have an impact. You also need to do some regulation, to do some control and quality control. I hope that answers your question. I don't know if colleagues.
Christopher, it might be good to hear from him from a technical, because it's great to have a standard, but it needs to be adopted and then also enforced.
Yeah, and I think this conversation has to take place between governments and industry itself. And I'll give you a little example. You know, this is an evolving conversation. In California this past year, California upgraded, actually set a new law that limited how much lead can be leached from water fixtures. And, because of that, in the conversation with industry, we had to change, the industry standard to adjust to that new law. It's the new NSF 61. But from that, manufacturers that want to compete in the California marketplace now know that they have to adopt, make the adjustments to their products to be able to compete in that marketplace. And, from that, it's just changed the entire marketplace in the United States, because California is one of our largest, economies in the United States. So when we're talking about, particularly if we're looking at some international markets, a lot of times there may be technical standards on the books, but they're not enforced. There's no mandatory requirements. So we see inferior and unsafe products being put into these marketplaces, and there's no way for consumer to be able to discern. So it has to be a conversation with industry there saying, hey, we are going to begin to regulate. We are going to begin to enforce, stop product at the border. We are going to, work with the local governments to be able to put in the enforcement mechanisms to ensure that quality products being used into projects and in our procurement processes. Let's have a conversation what that benchmark should be. Ideally, they're going to compete, these manufacturers are going to start to compete in the global marketplace. And, United States isn't alone in where they're going with their regulation of lead. And so to be able to compete, and be able to export product, they're going to have to be able to adjust their processes to meet these international standards. I will just make one other point. I mean, we talk a lot about lead. We're focusing on lead and the dangers of it. But, from us as an industry, these standards cover more than just lead. I mean, the entire performance of the system, the longevity of the system, plus other chemicals that are being leached in to the water from inferior product, a lot of those issues get resolved or certainly get improved by, implementing some of these processes. So certainly, I just want to, it is lead, it's important, but, we're talking about overall, water quality and performance of the water and sanitation system.
So yeah, we have a question here in the back and then over here.
Can I just
yeah.
add to it? So thanks so much for the questions. So just very quickly on the one about blood lead levels. So what it's telling you is the exposure, but yes, you don't know what source it's from. And so that's why it's important to check all the different sources of exposure. And thanks again for bringing up the point about not just having standards, that's just one step. And there are examples where countries have had standards and then they do water quality testing and they see that there's high lead levels. And that's been in the news and several times about this. And so it highlights also that even if you have standards, and there should ideally be mechanisms to be checking to make sure that the right materials are being procured. But there's also the role for water quality testing as the ultimate verification step to make sure that these materials are actually being used. So.
Yeah, and just to quickly add to that, I mean, look, there are technologies to do that kind of testing so that if you have materials and you have them on site, you can do testing on site to see what the lead levels are in those materials before you install them in your systems. And so there are steps you can do to do that step in advance.
Thank you so much for very informative discussion and also the presentation. It's not a question, it's clarification. So are we saying that we don't have any data on water quality sample testing with regard to lead? It's a clarification.
Okay.
That all this analysis that has been presented is more about presence of lead in blood rather than presence of
in water as well. Yep.
Is water as well. It has been okay, and that is a study done by UNC.
Yeah, most of the testing has been done in water supplies and water supply systems. There actually is very little. UNICEF is doing some blood level lead collection as well as others, but universally, we're still not doing broad-based testing for lead, and we're certainly not doing broad-based testing for lead within individuals.
Follow-up question is it possible to attribute whether the presence of lead in water is due to geogenic reasons, or is it because of water-related equipment or fixtures related? Is it possible to do this? And if yes, do we have some more data on that?
So the primary source of lead in drinking water is lead containing materials, but there are places where it is geogenic contamination. So through water quality testing, so adjusting the protocol, you can determine what is the source of lead. And so the technical brief that we've just published includes some guidance on considerations for sampling to determine what is the actual source of lead in drinking water. So that's really important to understand, because that will really inform what mitigation options you should be undertaking.
Yeah, and to be clear, the studies that we did not find a connection to geogenic sources. It did find a connection directly to the parts that were within the system.
Thanks, everyone. My name is Christine Poo. I'm finishing up my PhD at Stanford. I had a question about prioritization, and I know that's a conversation that many of these organizations have constantly with governments and organizations. I know that there's been a lot of optimism throughout the sessions about there is something we can do, and here are the recommendations, and they exist for multiple different things. So even within water quality, as was mentioned, there are different chemical parameters we're looking at, different biological parameters that we're looking at. And I'm curious, in these conversations that you have, how do you think about prioritization? What are the contextual features that you're thinking about with respect to each region of what you would advise them to focus on? And maybe it's looking at, well, what's market ready? Or maybe it's looking at what are the existing governance structures that would lend itself well. But what does that look like? And I'm not looking for a blanket solution that everyone's going to take away, but what are some of the factors that you're thinking about?
Let's take that.
Go ahead. I'll go after you.
Okay. Thank you for that really important questions. In terms of health risks, we know that microbiological contamination is the biggest threat to drinking water. And so that should be the primary importance. But we know that there's many other contaminants in water, and that should be considered. So how do you prioritize those? And there's only actually been a few chemicals that have been considered to be of public health significance in drinking water, like arsenic, like fluoride, lead, etc. And WHO actually has a guidance document on how to develop drinking water quality regulations and what are the considerations for prioritizing parameters. So yes, you need to think about health risks, but you also need to think about, the feasibility in terms of implementing control measures to reduce concentrations in drinking water. You also need to think about analytical capabilities. Do you have the equipment to analyze these compounds, etc.? There's so many other factors, and each country, it should be a little bit different, but there should be, first get the basics. In terms of the materials, I mean, there was a really good point that Chris brought up with lead, and that material standards are very critical. And it's not about just lead-free materials. It's about ensuring it's materials that are safe in contact with drinking water that will result in reducing contamination, leaching from materials, many contaminants. So you can think of these things holistically. And a lot of the things with the recommendations that we're providing in this technical brief, it's going to address, it's focusing on lead, but these actions will also support reducing other contaminants in water as well.
Yeah, Jennifer stole my thunder. I was about to say, certainly as an implementing agency, World Vision that focuses on children, I think it's important to remind ourselves that a lot more children die today because of microbial contamination in water supplies than from lead or other trace metals. We really have to remember that, while at the same time taking the lead issue seriously. In terms of prioritization, I would also throw in that certainly from our standpoint, our number one priority, probably I would say, is getting governments to own leadership in the matter. And every context is going to be different in terms of how priorities need to be set, but governments need to take responsibility in establishing those priorities. So I think certainly in LMICs, that's a top priority that we can do to get governments to own.
And it's got to be prioritized there, right? Before I just quickly turn back over for the conclusion, we've had a number of conversations with governments where you ask about piping and oil and gas. and they can tell you what the technical standards are. They can tell you all the processes that they put in place to ensure the safety and the equipment that they're using. You asked about textiles, it's the same thing. When you ask them about water and sanitation, it's, oh, that's a community-based solution. We rely on that. And so it has to be priority for the governments to take action on this. I just wanted to echo that point.
Well, and to be clear, this shouldn't be a trade-off necessarily between, microbial contamination and lead contamination coming from parts and things like that. We have to keep in mind that the impacts of lead are lifelong and profound. And if there are ways that we can, actions that we can take today to reduce exposure, I think it's our responsibility to take those steps.
Great way to close it out, Aaron. We will turn the time over to close out the session today for Jorge with UNICEF to say some concluding remarks. But thank you again for coming, participating. This is an important issue, so thank you, Jorge.
Well, first of all, thank you very much for all my colleagues from IAPMO, from World Vision, from WHO, from the Rural Water Supply Network, from Leeds University. Aaron, thank you very much for waking up very early in the morning at North Carolina. And thank you all of you for being here today. I mean, we know that there are many sessions running in parallel, so thank you for selecting this session. I think we all hope that this message becomes viral and you contribute to spread the voice, to raise awareness on this topic. And I just took some notes and some reflections as Bruce said at the beginning. Lead is a health issue. It has been hidden for, I believe, too long. Maybe because we haven't tested correctly. Because you need sometimes specific protocols. You need to adjust your protocols for identifying lead concentrations, as Johan mentioned. If we do some further research at country level, we might be surprised that the problem might be much bigger than what we all believe nowadays. Maybe not, but we suspect that the problem is much bigger than what we all believe before as a sector. There is need for government leadership, for transparency, but also for support. The government alone cannot do it together, and that requires a multi-stakeholder holistic approach involving the border controls to make sure that materials imported meet the national standards. The other key message is don't be scared by the size of the 50 billion PA, or the problem is just too big, or this is not the top priority at the moment in the water agenda. I believe that there is, I don't know if it is the right word, a ripple effect. If you work on lead reduction, you also address the reduction of other toxic metals that we haven't talked about today, but you also reduce this. You also contribute to bacteriological contamination. You can also improve water quality because the solutions are sometimes similar. Water safety. So addressing lead also has other effects in other agendas. And last but not least, each country is different. Each country would need different strategies, different priorities. We hope to work with all of you and with a larger group of stakeholders and countries to really make address this problem in the short, mid, and long term. Thank you very much, and have a good lunch.